House studios on Ngunnawal country here in Canberra, and Fran Kelly's back with us from Sydney as always on the land of the Gadigal people. Welcome once again, Fran. Now, after a sketchy start to the week, the ALP's campaign has today turned back towards tried and true territory. Medicare funded clinics was the turf, Fran, that Anthony Albanese chose to run on today.
Yeah, absolutely. Labor announced these urgent care clinics, 50 of them, at a pledge of $135 million. Scott Morrison, of course, starting day 3 at a factory in Western Sydney. He's had a few factory visits, but Labor's pledge was really getting them onto safe ground, Greg, which is, health and Medicare.
Good to see you. Can I get a photo? Is that all right? Are you in the press pack, eh?
No. This man, who we later found out is a Labor supporter, gate crashed the event.
You are a disgrace!
His actions were entirely inappropriate. We need to have civil discourse. Civil discourse. These Medicare urgent care clinics will be open longer hours, 7 days a week. They will be in every single state and territory. Importantly, the services will be bulk billed. Australians won't need their wallet, they'll just need their Medicare card.
Tell us about George Christensen not bowing out of politics, he's swapping parties.
Confirmation today that he's joining Pauline Hanson's One Nation party, and that then could actually cause quite a problem for the government.
The economic plan we have to keep going forward has fuel security very much at its heart. And that isn't just about the economy, that's about Australia's sovereignty. At a time when we're seeing supply chain stress, when we're seeing global uncertainty, our ability to refine fuel here, right in Australia, matters very much for our own strength and our security going into the future.
You said you'll take all questions, Mr. Albanese. Why aren't you taking all the questions like you agreed to? So we're not taking...
All right, so Fran, the pace was actually off a little for both leaders today, and we will in turn cover the day for both of them. But why don't we start with Anthony Albanese? He does seem to have gone for a less is more approach to the number of words expended today, which was consistent with some insider accounts that it was felt anyway, that he needed to tighten up on the crispness of his daily messaging in media conferences. So, Fran, is this a marked departure in your view from the first couple of days?
Well, it is, and you're quite right. It's because he's getting advice, which, he really needs to, as you say, tighten up. And that has the dual benefit of making him seem more succinct and more a message, but also just leaving aside chances for any sort of gotcha questions. You heard the journalist at the end there saying, why aren't you taking more questions, Mr. Anthony Albanese? You'd said you'd take all questions, which was a thing that Anthony Albanese had made a point of saying, thinking he was contrasting himself to the Prime Minister, who gave such a very short opening address and opening press conference when he announced his campaign, Greg. So Anthony Albanese had tried to make a sort of a positive of that. Well, after that first day gaffe, his own side of advising him, just let's limit the chances for mistakes here. And that's what I think you measured it, Greg. The first, his press conference today went for 8.5 minutes. That was a lot shorter than the press conferences of earlier days.
Exactly. We just want to make sure we were speaking from a factual basis. And if you run the stopwatch over it, it's a pretty stark comparison, Fran. That opening media conference out of Sydney on Sunday, the day the election was called, 35 minutes plus. Actually, I think it was closer to 37. Today, as you say, 8.5 minutes from go to woe, and we just saw how journalists were left still shouting questions as the leader walked off. Why don't we switch it over to the policy pledge that was made, though, and that was to trial at least 50 urgent care clinics, they're calling them. These would fill a gap between GP visits and hospital emergency department services, about $135 million in cost, which seems relatively cheap under $3 million, in fact, per site. But once again, Anthony Albanese gave a decidedly brisk explanation when quizzed about that costing.
When you consider the fact that a GP earns about $200,000 a year and you want them to staff 50 facilities 7 days a week, 14 hours a day, How are you possibly going to afford to build 50 of these facilities when in 2019 building one costed 15 times as much?
No, because it wasn't the same commitment. It wasn't delivering the same service. We promised different commitments in 2019. We promised also a commitment in Fremantle and something in Bribie Island. It was a different commitment, different policy. This policy has been costed, like all of our policies, by the Parliament. But this has been fully costed by the Parliamentary Budget Office.
OK, well, we might try to tease out, Fran, some of those costings and other features of the Labor campaign with their spokesman Jason Clare in a few moments. But before we get there, yes, why don't we flick it over to the Prime Minister, Scott Morrison. Where was he at today?
Well, the government's policy announcement was relatively minor, $250 million grant to Australia's two remaining oil refineries. So the Prime Minister, sort of on cue, went to visit one in Geelong, pitching this, as we heard earlier there in that opening montage, as a $250 million down payment for fuel security in these troubled times where, with the pandemic and, of course, now the Ukraine war, sovereignty is an issue. But, Greg, it does seem certainly to be a re-announcement of a measure in last year's budget, part of a $1.8 billion package there to the oil refineries. So a smallish announcement, but the Prime Minister too didn't speak for a long time today, but he did make sure that when he did, that this announcement fitted into his key message of the campaign, which is you can only trust the government to manage the economy in these tough times. Here he is.
Australia's financial management situation is not experiencing the same things they are overseas, and as a country, Australia has outperformed those countries, not just in terms of economic growth, not just in terms of having more jobs, but also in terms of some of these key issues. While, yes, there are inflationary pressures in our economy, that is very, very true. And so who you choose to manage the country's finances at a time like this, they need to know what they're talking about and they need to know what they're doing.
Yeah, so there you go once again,
Well,
Fran.
really, I think, Greg, as I say, not a reheat of an announcement and funding announcement already made by the government a year ago, but it was all about that last line. It's all about that last line that the Prime Minister got to sort of message there. It's about who you choose in these tough times.
Too right. I mean, compare and contrast, that's the Scott Morrison technique. And let's face it, Fran, no one in the coalition ever seems to stray very far away from the character of Anthony Albanese, even when they're talking about things like fuel security, which is an unusual combo to tie together. Peter Dutton is not renowned for his subtlety either, Fran, as regular viewers might be aware. So right on cue, the Defence Minister made sure that he didn't miss in trying to, again, frame Anthony Albanese as the issue.
He's now wanting you to believe that he's the complete opposite person of what he's been for the last 20 years. He's been the leader of the hard left of the Labor Party. And now he wants to tell you that he's John Howard Light, or that he's, Bob Hawke reincarnated, or that somehow he's Anastasia Palaszczuk in a sort of souped-up 2.0 version. It just doesn't add up. The guy is not credible, and I think Australians are starting to sniff a fake here.
So there you go, absolutely no subtlety about that, accusing him as being, an uber left-wing leader, left-wing guy. I mean, that doesn't quite stack up either. If you recall, Anthony Albanese at the last election, he was actually uneasy with the talk from Bill Shorten and others during Labor's campaign about the top end of town. So I think, it's certainly over-egging it to describe Anthony Albanese like that. But the big point there was this is Peter Dutton, the one rolling up his sleeves and really getting stuck in, with the Prime Minister we heard much more measured. But that's definitely a line of attack the government's going to keep pursuing, at least for this week, Greg. And Anthony Albanese, as we mentioned, opened the door to them to allow them to do that with his mistake on day one. Anthony Albanese has been under pressure. His confidence has been a bit shaken. The advice from the team around him is just let's keep it tight, let's get through to Easter probably, I imagine, is the strategy, and get some breathing space. Meanwhile, they're trying to get onto their safe ground of Medicare. And a little later I'll be talking about that urgent care clinics idea, that GP clinics idea with Stephen Duckett, the father of Medicare, and Omar Khorshid from AMA.
Yeah, good. There's a bit to pick through because there were already questions being asked, weren't there, about the costings and what comes of that. We do hope a little later, Fran, to bring Jason Clare into our discussions and to pull that apart with the Labor campaign spokesman. But just for now, we're going to take it off to Queensland, and Pauline Hanson is up for re-election to the Senate this time around, and she's gradually filling out the ticket for her running mates to join the One Nation column in that state. The latest recruit into what it must be said is the unwinnable third position is George Christensen, who held the seat of Dawson, of course, for the LNP for the last 12 years. He told a Brisbane media conference he's relieved to have switched camps.
I've terminated my LNP membership, I've joined One Nation, and now I'm here. So, you know, I see that other people have been out there saying, oh, you know, it's traitorous and this sort of stuff. Well, that's nonsense, I've got to say too. The only thing that I was perhaps a bit traitorous to was my own conscience, knowing that some of these policies that the government was pushing that I vehemently disagreed with.
OK, so One Nation's other Queensland senator is Malcolm Roberts. He's not up for election this year, but he was at today's event, and he's joining us now to help understand the thinking behind George Christensen's signing. Welcome, Senator Roberts. Given that most pundits would easily agree George Christensen can't win from third spot on the ticket, what in fact is he bringing to the party?
He's bringing a desire to get back into the Senate in a party which has similar values to his. We believe in no 2050 net zero policies. We believe in COVID mandates and other forms of restriction of freedoms need to go. And George has been grappling with his integrity as well, not his integrity, his consistency, as he's just said, quite freely. And he's been very public about that. He brings his experience in Parliament to us. He brings his candour. He's a real person, just like all of us in One Nation. So he brings that, and I think he's establishing his mark, and at the very least, and hopefully we'll get into the Senate.
Do you agree on the numbers? You would have to get 28, northwards of 28% of the vote, I think even up to a third of the vote to secure as many seats as would be necessary for George Christensen. So even you would have to acknowledge, wouldn't you, Malcolm Roberts, this is an unlikely scenario?
It's a challenge for sure, but there's nothing that Pauline Hanson or I or George like better than a challenge. And George is aware of the numbers, but he's not running away from that. He wants to show his faith in the direction we're heading. We're very consistent with what he's believing, what he's been pushing very hard. He's clearly out of step with the Liberal Party, the modern Liberal Party. So, yeah, it is a challenge. But, you know, Pauline Hanson got around 23% of the vote in the state elections several years ago. She's rising continually into that. And we've now got a very, very unusual situation in federal parliament, Greg. I think everyone is acknowledging that. There's going to be a lot of uncertainty. The Liberals won 3 last time with the help of preferences to get the third candidate over the line. And with the help of preferences, there's been a massive, massive swing away from the Liberal National Party. The National Party has abandoned its base and fallen into bed with the Liberal Party, and the Liberal Party is now run by a few dictators. So people are very much out of sync with the Liberal Party. We know for a fact from senior former donors and organisers for the Liberal Party that they have left the Liberal Party. They're now coming to the other parties, and we've got massive resignations of members from the Liberal Party, and they're coming to us, some of them.
All right.
And so we've got a high potential to get a dramatic increase in votes.
Yeah, and just on that, I'm sure you'd be aware of some people grappling with explanations for George Christensen joining the party. One is pretty obvious. I think at last count, the public funding component per vote that parties get from the Electoral Commission is about $2.83. Would it be in your calculations that he, in fact, is good financially for One Nation, given that public funding?
Greg, you're sounding like the ABC again.
I am the ABC.
I know that, but you're usually not in sync with their their general tone about being anti-one nation.
Just asking. No, they're just asking the questions, covering off some of the rationale.
I'm just answering in the same way. No, that's not at all anything that Pauline does. She does not do that for money. She never has, never will. This woman has the highest work ethic in the federal parliament. She has the highest integrity. She's got beyond all of that. She does things that are in the best interest of the country. She knows that George has got a lot of fight left in him. She knows that George is true to his values, and they're very much aligned with us. We have had many. I've dealt with George for years now in lower house of Parliament, and I've dealt with people like Craig Kelly, Jared Rennick. I find them wonderful people to deal with. So no, this is entirely sincere. It's very much about trying to get 3 senators elected, and very much about making sure that One Nation has a good showing at these polls. Yeah. George is coming because he believes in what we're doing. Now, very much so. The zero mandates.
Yeah, fair enough. I know you've got other commitments to get to, so just one last one from me. Malcolm Roberts, casual vacancies, of course. Some voters might go to the polls looking at options that occur further down the track. If you, or for that matter, your leader, were to go in the midst of the next term or another term, could we assume that George Christensen would be the P to take over either position?
You can always assume that Pauline, when she chooses that and we give her input, we'll select the best candidate. There's no way I'll be going before the next election, and I don't think Pauline will be going before the next election, so it's a very rare likelihood. But if something does happen, then Pauline will certainly pick the best person for the job. She never guarantees anything. It depends upon performance, loyalty, and above all, being loyal to the people of Australia and serving the people of Queensland and Australia.
And so you'd have to test George Christensen on those measures, would you?
Not at all. No, George, I've dealt with him, as I've said, for a number of years now. Always a man of integrity, always stands up for what he believes in. He hasn't had the support. We will give him that support. We will be backing him. His approach to life, to politics, is very similar to ours. Be upfront, tell people where you stand, and listen to the people and speak for the people and serve the people. That's George. Yep. We're very happy to have him. Absolutely delighted to have him. I look forward to working with him.
Yep, certainly a bit of a surprise you pulled today, so we'll see how that goes in the weeks ahead. Malcolm Roberts, thanks again for joining us on Afternoon Briefing today.
Thank you for having me, Greg. A pleasure.
OK, so let's check in now, as promised, on some of the campaign issues of the day with Labor's spokesman, Jason Clare. He's with us from Sydney, and apologies for any delays there, Jason. Clare, the style of the leader's daily campaign messaging, Fran and I just reflecting on that, and we're obviously not alone. Why has it changed? We may still have a problem. I'll just go again. Jason, hopefully you can hear me. The question was...
Can you hear me there, Greg?
Yeah, I can. Loud and clear now. Sorry for that. A few gremlins today. So if you didn't hear the question, it was why. Why has the style of messaging from Anthony Albanese, noticeably a shorter media conference, why has that changed?
Oh, you know, you'll answer a lot of questions one day, you might answer a few less the next. I'll bet $10, Greg, that Anthony Albanese will answer more questions from journalists over the course of this campaign than Scott Morrison will. What we were talking about today was the same thing we've been talking about over the last few days, and that's Medicare. The Labor Party is the party of Medicare, that green card that people have in their wallet or their purse or their pocket. That's there because of Bob Hawke and Labor. It means that when you're sick, you pull out that card, not your credit card, but we need to make it stronger, and that's what the policy we announced today was all about.
And I do want to pull that apart and look at some of the costings with you in just a moment. But there were these reports today. I think Phil Curry in the Fin Review was one, saying that someone in the campaign had diagnosed a need for greater brevity. And then, of course, there was the celebrated failure to remember some economic data on Monday. So 35 minutes was the opening gambit from your leader, down to 8.5 minutes today. I know we're not going to run a stopwatch over each and every media appearance, but there's been a change. I'll just put to you again, what's lying behind that?
Oh, look, I wouldn't look too much into that, mate. Albo forgot a number. Scott Morrison forgot to order enough vaccines. Let's put all of this in perspective here. I'll make the point to you that I made to Lee on 7:30 the other night. politics is not a pop quiz. Leadership's not a pop quiz. It's not a game between journalists and politicians here. This is about the future of the country. It's about making sure, leadership is about making sure that you understand the problems our country's facing and come up with ideas to fix them. That's what we're talking about today by strengthening Medicare. It's the same reason that we've come up forward with policies to fix the crisis in aged care, to make childcare cheaper so that more and more Australians can get back to work and their kids get a better education. The same's true with the policies to build more affordable housing, make it easier for young Australians to buy a home.
Yep.
And for that matter, Greg, the necessity in this country, long overdue necessity, to set up a National Anti-Corruption Commission. I noticed the Prime Minister in his late afternoon press conference refused to commit to doing that. He promised it at the last election, never delivered. Now it seems he won't do that if he wins this election. There's only one way we'll get an integrity commission at a national level, and that's if Labor wins this election.
Yeah, he's put it up as a take it or leave it proposition. One final one just on campaign style. So no confidence rattled in your leader in the opening days then?
No, not at all.
OK. Medicare urgent care clinics, what actually are they funding at $135 million? Because it doesn't seem an awful lot of money for 50 sites.
Well, it's not about bricks and mortar. It's about extending the operation of existing GP clinics and community health centres. So they're open from 8 o'clock in the morning till 10 o'clock at night. Let me give you a real life example, Greg. It might help to make it easier for people to see the policy and how it'll help.
Sure.
At Christmas time, my 13-year-old nephew fell over at my house. We thought that he'd either sprained his wrist or he might have broken something. We took him to the hospital. Because it was COVID, we couldn't go inside the ED, so he was in an ED full of people waiting to be helped on his own. Didn't get an X-ray until midnight that night, until we finally got him home. There's 4 million examples of that right across the country every year where people have either got a sprain or a cut or a burn, they've got something in their eye perhaps or their ear that they need help with, where they don't need to necessarily be at the emergency department, but there's no GP that's open at the time.
So this is a halfway house position in between the GP and the ED. I guess it's always been a pinch point around the ED. But even
and it's about making sure that you don't have to pay, right? You know, it's fully bulk billed. It's about extending and strengthening Medicare and making sure that you take pressure off those emergency departments. They're under pressure like never before.
Yeah, so is it just the bulk billing component that is covered by this costing? Because if you do the basic mathematics, allowing for the fact you say we're not buying bricks and mortar here,
That's right.
We're paying for services, it comes down to about $670,000 on average per site per year to operate 14 hours a day. What exactly is that buying?
So what it covers is that bulk billing. It also covers block payments because the ordinary rebate that a GP gets for a normal consultation is not enough to cover this sort of work, and that's why you need those block payments as well. It also has money there for equipment that GPs need. The important point to understand here, Greg, is this has been tried and tested by the Kiwis. In New Zealand, they do this and it works. On a per capita basis, they've got lower rates of ED admissions in New Zealand than I think any other developed country in the world.
Yep.
So here's a practical, sensible, common sense policy that will work, that will help people that are crook and don't need to be at the hospital and can turn up to one of these centres and get the help that they need.
And this is called a trial because why? Because it could be extended beyond the initial 50?
Yeah, that's right. So trialling it at 50 sites, get it up and running, see that it works like it is over the ditch, and then it's got the potential to expand.
All right. Now, Job Seeker, Labor's cleared up its position. There is no review and ipso facto, no increase because it's not affordable, not on the horizon anyway. What does that mean Labor would actually consider at each budget when it comes to job seeker payment? We're told by your leader that he would consider at each budget. Well, consider what?
Well, Albo said it's the job of a treasurer, it's the job of a government to go line by line through every budget every year and see what you can do to help people in need. But the fact is, this government is leaving Australia almost $1 trillion in debt. That's $1 trillion in debt. That means that we're going to have to make some hard choices and you can't do everything. But I'm pretty proud to be the author of a policy that's going to help Australians in some of the most desperate need. We've got more homeless Aussies today than ever before. Outside this studio in Ultimo, Sydney, you'll find people sleeping in the streets. 1 in 10 of those are veterans. It's unbelievable, Greg, but true, that you've got 1 in 10 people sleeping on the streets in Sydney as a veteran, someone we trained, sent overseas. We say on Anzac Day, it's coming up, that we will remember them. But that's not true. Not if you've got 1 in 10 people sleeping on the streets of Sydney, a veteran. Our $10 billion Housing Australia Future Fund is about building homes for them. It's also about building homes for women and kids fleeing domestic violence.
Sure. So would you consider at your first budget, Treasurer and Prime Minister and others, each and every social security payment and its adequacy each and every year, but particularly in the first budget, which in the case of a Labor government could be 6 months away?
That's what governments should do each and every year. They need to look at the budget and see how it can respond to the needs and the issues in the local community.
So a review could be possible at Jim Chalmers' first budget in 6 months from now?
Well, we're not committing to do that in this election. We're saying that you can't do everything, you can't fix everything that is an issue in the community in one election, in one budget. But what we can do is develop targeted policies that are going to help people in the most desperate need. Homeless Aussies are an example of that. And as I said, the biggest group of homeless Australians are mums and kids, and many of them are fleeing domestic violence. At this election, we're taking a policy which is a $10 billion housing fund that will build thousands of homes for women and kids fleeing domestic violence. It's a $1.7 billion investment here in homes just for women and kids fleeing domestic violence. And to put that in perspective, Greg, that would be the biggest investment in permanent housing for women and kids fleeing domestic violence in the history of this nation. History of this nation. So we're making serious commitments here. By contrast, yesterday the Prime Minister was asked a question about an aged care worker sleeping in a car, and his answer was buy a house. It shows just how out of touch this government is.
Yeah, noted. We'll no doubt have further discussions about this and other policy matters on the way through. Jason, Clare, thanks for joining Afternoon Briefing, and once again for your patience on a few technical gremlins today.
No worries, mate. Thanks.
Yeah, OK, Fran. So, look, Jason, Clare, sort of, I guess, filling out some of the details around this Medicare urgent clinic, or urgent care, I think it's called, a policy that they've announced. It does sound like it covers just that bulk billing component for these services, hence the explanation.
Well, yeah, as we said earlier, $135 million, that's not huge in the scale of the health budget and the Medicare budget in particular, but I think it's about that key message. You know, we were saying earlier the Prime Minister's key message was, you know, they know how to run the country and run the economy. Labor's key message for this part of the campaign is all about defending and extending Medicare. And, you know, Medicare has remained ever since. I remember when John Howard was running for Prime Minister, he had to specifically come out and said he will not wind back Medicare. And ever since, coalition governments in election campaigns have had to make that similar promise. So you'll hear the Health Minister doing it. So Labor, in contrast, thinks this is their territory and they'd like to stay on it for as long as they can. Thank you very much. Yeah, we're getting lots of versions of that. I noticed the Prime Minister using a variation on that theme, you know, a better friend of Medicare, never have you seen before. That was, in effect, the assertion that Scott Morrison was making on health today, although we do await further instalments, if any, from the coalition side on all of that. Yeah, indeed. Greg, I was very interested in the chat with Malcolm Roberts earlier about George Christensen running for One Nation. You asked Malcolm Roberts, was this about trying to get the extra dollars that he gets through at every election? Through every candidate? Mortally offended, apparently. Mortally offended. And, you know, I kind of agree with him because I don't think there'll be that many Senate votes for George Christensen in the scheme of things. But what there will be, I don't think Pauline Hanson is doing it for the dollars this time, but I think she is doing it for the profile that George Christensen has amongst all those who are very angry about the government's management of the pandemic, you know, the anti-vax, the anti-lockdown, the anti-vaccine mandate core of votes there. Pauline Hanson will get a real boost in sort of profile amongst that slice of the electorate. And so I think, you know, it might just give her a few percentage more votes for her standing. There is no way George Christensen will get that third position. What he will get, though, Greg, is a payout. Yes, I was going to bring that up. Exactly. Yeah, well, Yeah, I mean, you know, you don't get any money if you quit Parliament, but you do get money if you lose an election, don't you?
Yeah, and so the figure, as best we can tell, is $105,000 if George Christensen should manage to be defeated. I use the word manage advisedly, Fran, because that is the trigger that gets you the paycheck of $105,000. It's being defeated. It's not walking away voluntarily as he would have done up until today with his departure from the seat of Dawson, Fran.
Yeah, I'm not suggesting that's the only reason George Christensen has signed up with One Nation. I mean, he's a young man. I think he's only 43 or something. He's got a very strong following in his seat. He increased his margin in that seat significantly at the last election, to the surprise of many.
11%,
you know, maybe he's not quite ready to be done with it, but I don't think running for the Senate for One Nation is going to get him there. But is he positioning himself somewhere else, as you were hinting at? You know, Pauline Hanson, if she moves aside, is George Christensen likely to take over?
We're good at hypotheticals. I didn't truly expect Malcolm Roberts to go there, but it was worth a question anyway, Fran.
Yeah. So, Greg, while there is a battle for Senate positions between Clive Palmer's United Australia Party, Pauline Hanson's One Nation, the Greens are also in the hunt for those last seats in the Senate contest. It's really in the House of Reps, I think, that the battle for the hung parliament is going to be critically watched on election night. And that battle is more about the independents who are taking on some Liberal MPs in some of those safe Liberal inner city seats in Melbourne and Sydney in particular, where climate policy is a major battleground. Wentworth, you might remember, in inner city Sydney was lost once to independent Dr Karen Phelps, but Dave Sharma won it back for the Liberal Party for the government at the last election. In this campaign, Dave Sharma is facing a strong challenge from independent Allegra Spender, who joins me now. Allegra Spender, welcome to Afternoon Briefing.
Thanks so much, Fran. It's great to be here.
I think the first question for you, because we are all looking at a real possibility of a hung parliament come election night. If you were successful in Wentworth on election day, and we are in hung parliament territory, who would you support?
Look, I've said I'm willing to support either party because for me it's about the policies, it's not actually about the parties. And I'll be really looking at issues around climate, integrity and a future-focused economy. And regardless of who actually gets control and supply, I will be voting issue by issue on what's important for the values of Wentworth. And I think that makes me distinct to anyone else standing in Wentworth.
All right, but you would know now, wouldn't you, who you would support? You know their policies.
Look, I think they're going to be very open to negotiation if it comes to a hung parliament, and that's what I would really want to see, what they're willing to come up with.
So what would be your bottom line? What would you want in guarantees?
I think that absolutely we need to look at climate policy, integrity policy, and do we have a future-focused economy that is also inclusive? Those are the critical issues for me.
All right, let's nail that down. Climate policy, what would you want in return for your support?
I'm looking at really hard targets for 2030 and policies that really back that up.
Well, Labor's got a hard target at 43%.
Neither party have a good enough target in terms of 2030.
Oh.
And it's also about the policies that back it up that are going to really drive it. And the ditto with integrity, it's about a strong federal ICAC, but it's also around issues around donation reform and around, how do we manage the grants and the allocation of public money in a way that's good for the public rather than good for the parties.
Is your starting point, though, you want a commitment from a federal government, whoever might be in the race for that, of a National Integrity Commission?
Absolutely, that's one of the starting points there.
Well, I'm sure you've had a look at the government's model. Would that be good enough for you?
It's not good enough. I think Helen Haines has got a great model there. But again, I'm just open to the discussions at the time, and I think there will be an opportunity to have real leverage and movement if it comes to that.
What are you hearing from your constituents, though? Are they asking you this? Presumably they'd like to know, before they cast a vote for you or not, who you would support. And presumably most of them are Liberal supporters because apart from the time when Karen Phelps was elected, the by-election, it's been Liberal.
Look, I think the people in Wentworth come and talk to me about what are their values and are they being represented in Parliament? And that's what they're seeking. They're not saying, well, I want the Liberal Party. They're saying, look, I want action on climate change because it's important to my kids and my grandkids. They're saying, I want a government I can trust and I don't feel that I'm getting that now, and what are the institutions that we can have in the future?
Are you saying that many of those voters in Wentworth who've been lifelong Liberal voters would be happy if their vote helped elect you and helped elect an Anthony Albanese government?
I think what they're saying is that that these are the issues that are important to them. And as an independent, I'm saying that I can vote, and I'm really explicit with all the voters in Wentworth. I can vote on the issues that are important to Wentworth, and I think I can bring Wentworth's values to whoever's in Parliament. And I think that's really important, because then on a piece of legislation by legislation, I can advocate and I can vote on the basis of our values from this community.
I'm sure you're doing your own polling. How are you going there?
Yeah, look, we're really encouraged. I think this is, we've got a really, really great chance, but I think it's going to be a tough race, and we're absolutely ready for it.
Will you beat Dave Sharma?
I think I certainly think we will.
OK. Let's just go back to your climate policy. You're advocating, I think, a 50% reduction in emissions by 2030. Yep. That's a pretty rapid and expensive transmission. I mean, Labor did all their modelling when they came up with 43%. I'm sure they would have pushed it further if they thought the budgeting and the costing all worked out. How would you get that in that time while maintaining affordable and reliable energy supply?
Look, I think you need to come back to people like the Business Council of Australia. They are advocating for a 46 to 50% reduction by 2030. And the business.
They're also advocating for reliable energy supply.
Absolutely, and so am I. Like, I think I've run businesses. I think it's absolutely critical that people have reliable energy supplies. But I think the point on the Business Council of Australia is that they've made, and that I make, is that this is good for the country economically, and it also is good for the country environmentally, because we are one of the sunniest, windiest countries around. A solar panel here creates 2 to 3 times more electricity than it does, in Europe and other places. So this is actually our opportunity to do this, and so I think you need to really look at what the business community is actually raring to go on this.
Yeah, but the business community might be raring to go, but they're not having to dip into the budget, which is already $1 trillion in debt mounting up. There's this very expensive costs around transmission lines, which is what's critical to be able to get the degree of solar and wind energy into the grid that might be required to meet that target. Have you looked at those costings?
Look, I think I have looked at those costings, and I've also looked at the money that we spend on fossil fuel subsidies, which we spend around $10 billion a year. You've seen in both sides of Parliament, both sides of government at the moment, advocating and making commitments around investment in fossil fuels that we don't need. And so that's where I think that we should be shifting our attention to the future. And that's what people in Wentworth are asking me for.
The Liberal MPs are not happy with the independents running against them, who are funded and supported by the Climate 200 group. They call them fake independents. How much support are you getting from Climate 200? What kind of financial support are you getting?
Yeah. Look, I'd say to the MPs who say that, look, say that to the hundreds of volunteers that I have in my community and the thousands of supporters. Tell them that we're fake independents.
What about the dollars? How many dollars are you getting from Climate 200?
So I'm saying that this is about a community. This is about a community movement. The vast majority of the money I've got has come from the community of Wentworth, and I've got some money from Climate 200, which is again significantly the minority of that, and that's really been driven around. I've been using that to get match funding, and also to also pay for advertising, which is absolutely critical. So I don't have the number on there, but it's less than 30% of my campaign.
Is that declared? Do you declare that? When will you declare how much?
I would declare that through the AEC, in line with all the AEC recommendations.
So that's afterwards?
Yeah.
I presume that's one of the integrity measures you'd like to change, about having declaration of funding declared at the time. Why don't you do it?
Because I'm saying this because at the moment people are coming up to me and saying that they can't publicly support me because they feel that they are under attack. They will be singled out by people in the Liberal Party and the government. And so that's why I'm saying that we should actually change the rules in terms of political donations, absolutely cap political spending on elections, because this is, I don't want to see that in this country. I don't want to see one individual spend $81 million, as Clive Palmer did in the last election. So these are the issues that I really am advocating for, but I also can't run a professional campaign with one hand tied behind my back.
OK, so what's your total?
I've raised around $1 million, and that's around, so it's under $300,000.
Just a quick final one, because it's arisen in the last day or two of the campaign. You've called, I understand, on your opponent Dave Sharma to call on the Liberal candidate in Warringah to be dumped because of her campaign around women's sport and trans athletes. Is this an issue at all in your electorate? Has this come out at all in your electorate?
The community of Wentworth is one of the most socially progressive communities in the country, and we have a really big LGBTQI community. And I was really proud to be part of the Mardi Gras. And what that community is seeking is to not be singled out and targeted through the election as it currently is at the moment. And so what's been going on the last few days, and in relation to the sort of remarks which are, I think, really hostile to the LGBTQI community, that really hurts. That's not what they're looking for.
Is the Prime Minister's messaging around this? He said he'll have more to say around it. Is that resonating in Wentworth?
Yeah, absolutely. I think that's the LGBTQI community, and actually the broader community, don't see this as major issues that are driving the election. They think that this is distraction, and it's also divisive, and they don't want to see that. As I said, Wentworth is a very cohesive and a very open community, and we want to see those values represented.
OK. Allegra Spender, thank you very much for joining us.
Lovely to see you.
Allegra Spender is a candidate running against Dave Sharma in Wentworth. We did invite the federal Liberal member for Wentworth, Dave Sharma, to come on the program today, but he declined. Greens leader Adam Bandt was at the National Press Club today, and publicly funded dental treatment for all was the centrepiece of his announcements. A proposal the Greens are suggesting could be paid for by heavier taxes on corporate profits and turnover.
Dental care must be universal. It is a human right. Under our plan, everyone entitled to Medicare will be able to get bulk billed or rebated dental care, including oral surgeries and orthodontic treatment. The Greens want you to be able to use your Medicare card to go to the dentist. Under the Greens plan, you can go to the dentist of your choice and use your Medicare card, just like at the GP. Our policy will cost $77.6 billion over the decade, about $8 billion a year, funded by making billionaires and big corporations pay their fair share of tax, and it will make people's lives better.
Greens leader Adam Bandt at the National Press Club. Well, health was also on Labor's political agenda today, as we've been discussing, announcing they'd established 50 urgent care clinics across the country to relieve pressure on the public hospital system. The coalition hit back, saying the pledge was a reheating of the failed Rudd government policy for super clinics. The AMA was critical of the proposal too, and I'm joined now by AMA President Dr Omar Khorshid and health economist Stephen Duckett. Welcome, both of you.
Good to be with you, Fran.
Stephen, let me start with you, because you're often described as the architect of Medicare. These 50 urgent care clinics announced by Labor today, do you have an understanding of how they work and whether they're a good idea?
I think they're definitely a good idea. Emergency departments in hospitals are overwhelmed at the moment. GPs are also overwhelmed. And so I think what we've got, and what Labor is proposing, is somewhere between emergency departments and GPs. It's not going to fix the hospital problem, and we shouldn't have pretended it will, but it's certainly a step in the right direction. It's proven in New Zealand that it reduced CD presentations. So I think it's certainly a step in the right direction, and we should welcome it.
How is it different to the super clinics that Kevin Rudd did announce when he was running for the government? And I think they built 33 of them or something so far. Stephen, are you there? I think we've lost Stephen.
It's nothing like the super clinics. The super clinics were... No, am I there?
I've got you, yes.
The super clinics were freestanding. The super clinics were freestanding. They were not related to general practice, not an add-on. It was a totally different idea, and so the comparison is irrelevant.
All right. Omar Khorshid, the AMA, you've been critical of this urgent care clinic proposal. Why? I thought you'd welcome getting pressure off the hospitals.
Well, Fran, if it would actually take pressure off the hospitals and make a difference to what we describe as a logjam, then of course we'd be keen supporters. But the reality is that although these will be popular where people have access to them, and there will only be 50 of them around the country initially, which is, when you compare with the 8,000 general practices, it's a tiny drop in the ocean. But of course, it's the hospital patient that are jamming up the emergency departments, the ones that actually need admission, the ones that have acute illnesses that cannot be dealt with in general practice. Now, the way to reduce the numbers of those is to increase the quality of primary care, to get better chronic disease management in the community through primary care. And that's where we would like to see both parties investing if they want to help emergency departments. And of course, the other thing they've got to do is address the hospitals themselves.
I'll come to that back to that, but just this notion of the urgent care clinic, the way Labor's described it today, which is, you know, a kid falls off their bike and, you know, breaks their collarbone and they can be dealt with perhaps at this kind of urgent care clinic without waiting at an emergency department. I had that experience myself over Christmas. I had to go in to emergency and there was a little kid who'd just fallen off their scooter and the mum was worried about it and, you know, so it does happen. Would that not relieve some of the pressure, if not, as you say, all of the pressure that a whole redesign of primary healthcare might do?
Yeah, if you have a well-run urgent care clinic near a hospital, then it will reduce the number of presentations with those sorts of problems to the ED. That's obvious, and we would accept that. What it won't do, though, is stop the ambulances ramping outside because the whole ED is jammed up with the sick patients and there's nowhere to put them in the hospital. And that's the deeper problem. So whilst these do have a place, and they exist already in this country, there are urgent care clinics here in Western Australia right now, and we've got some of the worst emergency department performance figures in the country when it comes to ambulance ramping. So as Stephen said, they're no panacea. And of course, you also got to look at the impact they have on the GPs around them. And if there's anything good, I think, about what Labor have said, is they've acknowledged that providing urgent care after hours is actually really expensive. And these practices, these existing GPs who are lucky enough to become one of these places, will get hundreds of thousands of dollars to help them deliver this service. And what we're saying is, well, if that's what's needed to get general practice to a level where it can do this stuff, then perhaps we should be looking at the other 7,950 practices as well, and not just a very small pilot.
Stephen Duckett, your response to this criticism from the AMA, that point made there by Omar Khorshid?
Oh, I think it's a both and sort of answer, isn't it? That Dr. is actually to fix the whole hospital problem. And we should be actually improving primary care. The AMA has just released a set of policies about improving Medicare, and they're right on the money here. We've got to actually invest in primary care as well as what...
Stephen, I'm just going to interrupt you there. We've definitely got a connection. I'm going to come to Omar Khorshid on that notion because, as Stephen Duckett just said, you announced a plan called Modern Medicare today. You're calling on both major parties to support it. What is at the heart of that reform proposal? Because I think it's going to cost a lot more than $135 million that Labor announced today.
It certainly will cost more, but of course, any amount you spend on primary care is an investment in health. And of course, it's been shown overseas that when you invest in primary care, you save it with other health expenditure. So it actually ends up being a net saving, not a net cost. So we're talking about concepts such as the healthcare home, where a patient will sign up with a practice, they'll make a commitment to the practice makes a commitment to them, and particularly for people living with chronic diseases, that GPs would be funded to actually help them look after their disease in a longitudinal way, rather than just with a 10-minute consult on certain days through the year. In that healthcare home, you'll have allied health staff, you'll have some physios, some pharmacists to help with medication management. You may have a dietitian. Whatever that community needs could be available within this sort of place. And then you add on things like a wound care consumable scheme, so that people who've got chronic wounds can actually have their dressings for free, rather than either having to go and pay for them themselves in the pharmacy, like happens at the moment, or ending up in the public hospital outpatients trying to access that care. So it's really about a concept of reforming general practice to make it deal with the chronic diseases that are prevalent in our community, to actually design the system to match the need, rather than to keep the system with the same design we had back in the 1980s, and of course a design that's been underfunded for so many years.
Are these elements all part of the federal government's primary healthcare 10-year plan? Because Health Minister Greg Hunt has said today that the government has spent a significant amount of money on that plan already, $1.1 billion in primary care measures so far, putting an additional investment of $632 million. That was all announced in the budget. So they're putting some money there. Is that the sort of grunt that's needed to implement this primary healthcare 10-year plan?
Look, Fran, I really wish there was money in the budget for the primary healthcare plan. That statement is, to be frank, and with all due respect to the Minister, it is spin. That is the total expenditure on community healthcare within the budget, and not a cent of it was actually directed to this primary healthcare plan. The government did promise at the last election almost $500 million to implement this plan, even though it hadn't actually been finalised yet. That's been taken away. So the government has a plan, and it's a plan that the AMA, the College of GPs and many others support, but it's a plan that is completely unfunded at this stage. The government feeling that having done telehealth, they've done enough, but really they need to fund this plan. And what we need to see is Labor actually committing to a plan as well, not just tinkering around the edges.
All right. Well, Labor, Stephen Duckett, has Medicare and presumably a plan for Medicare at the heart of its election pitch. It's, you know, childcare, aged care, Medicare, Labor cares. This $135 million announcement, there was money yesterday for telehealth, for bulk billing psychiatric and psychological consults. If Labor's serious about a reform plan for Medicare, what would it or should it be announcing? What's at the heart of a reform of Medicare that you see the need for?
So I think a lot of what the AMA has said is absolutely right. I think the strategic plan the government announced on budget night is absolutely right. There's not a single cent in the budget for that, which is just disgusting, really. So the question then is, should Labor release something prior to the election, or should it say, this is a priority for us, we are going to deal with it in our first budget? And I think that's a better strategy, so that they have not been involved in the development of the 10-year strategic plan. It's got Liberal Party advertisement all through it. And I think Labor should step back and say, it's the right direction, but we want to own it. We want to make sure it's the right thing. We want to consider it in government, and we're going to commit to do something in the first budget.
All right, but they need to be hinting pretty strongly they're going to put a significant amount of dollars to it, otherwise it's a worthless promise, isn't it? And speaking of dollars, Greens leader Adam Bandt today called for dental services to be part of Medicare at a cost of $7.5 billion a year. Is putting dental care at the heart of Medicare, is that a sort of reform, I'll just ask both of you, stick with you, Stephen, the sort of reform you'd like to see as part of a revamp of Medicare?
Oh, I think dental should absolutely be part of the universal program. Whether you do it exactly the same way as we do with Medicare, fee-for-service uncapped, that's not something I actually support. But certainly we've got to say universal dental coverage is part of what Australia expects nowadays.
OK. Omar Khorshid, what do you think about this notion of dental care within Medicare?
The AMA certainly supports universal access to dental care. It is linked very much to health outcomes, and it is important that all Australians have better access to dental care. But if you're talking about spending $7 or $8 billion a year, right now we would be pointing that money at the part of our system in absolute crisis, which is public hospitals, and for the government lifting its commitment to 50-50 funding would cost around $5 billion a year, and I think that's where we'd see our priority with dental care, you know, being on the list of things to do in due time.
Finally, can I just ask you both about bulk billing? Because the government says the bulk billing levels are higher than ever. I think that would be news to a lot of people in a lot of places in the country where they can't seem to find a bulk billing GP clinic. Stephen Duckett, is it higher than ever? Is the government right there?
If you're only talking about GPs, the answer is yes.
Let's stick with GPs for now.
So the bulk billing rate is about 90%, almost 90% for GPs. That means still there's 10% of the population who aren't bulk billed. Only about 2/3 of the population have all of their services bulk billed. So it's still an issue. But the government's right on that, but that doesn't mean that's good enough. People still can't get, especially to see medical specialists, they can't get to see psychologists. So it's a big issue for a lot of people.
And Omar Khorshid, what would it take for more GPs to offer bulk billing? And do you have a response to that report released fairly recently that suggested some GPs, either by mistake or by design, are rorting the bulk billing system because they're charging a co-payment and they're getting the Medicare rebate?
Yeah, I think we've got to get away from measuring the success of our primary care system by the bulk billing rate. We actually need to look at how well we're managing diseases in the community, and where we're able to provide that in a setting where there's no fee for the patient. That's fantastic. But if you ask me, would I rather go to a GP that bulk bills but is under extreme time pressure and will see me for 6 to 10 minutes, multiple times in order to deal with my 3 or 4 problems, versus going to one GP that I've had a relationship with for a while and pay a co-payment with the capacity to pay? I would pick the latter. And I think what we've got to do is...
With the capacity to pay, though, that's the...
It is the question, Fran, but we have got a greater household income in Australia now than ever before, and people are willing to pay for quality healthcare. But let's lift the standard of general practice. Yes, let's lift the standard of bulk billed general practice. Let's get longer consults paid for through Medicare so that a bulk billed practice delivers better quality care than it does right now, because that's what we'd like to say. It's not the bulk billing rate, it's the quality of care that we've got to start to measure and improve.
Omar, Khorshid, Stephen Duckett, thank you very much for joining us.
Pleasure. Thanks, Fran.
All right. Well, Fran, discussions about health and hospital funding always inevitably end up at the Premier's table, don't they, these days? Because although we're picking apart the needs there in some of those discussions, there's the not insignificant matter of how much the states have got to put into the pot there. And that's a real patchwork these days when you consider, I think Western Australia is carrying record surpluses for any state on its budget at present. The split is meant to be about 45-55. I think there's a push to take it 50-50, but a lot of these arguments seem irreconcilable when you get into national health funding debates.
Well, that's true, especially if you're talking about taking the pressure off the hospitals. It's the states who fund the hospitals, but it's the federal government who pays for primary care, so there's that inbuilt tension there in terms of intentions. But I think everybody agrees, and always agrees, that 15-minute medicine or 5-minute medicine is really not great for the patient. It's not great for the GP. The Medicare rebate for GPs has not increased for many, many years. It's very expensive to make that change, and to make that change, I think GPs have to commit to a more holistic kind of care model, which is what Omar Khorshid was talking about there. I think there would be the support for the community to do it, but it costs a lot of dollars. And if Labor is really promising a reform of Medicare, perhaps Stephen Duckett is right. They need to be saying, well, you know, we're not committing to that big spend right now, but we will, in government, look to that as a priority. Yeah, interesting to hear the gap, the difference between the AMA and someone like Stephen Duckett on a lot of those principles is not actually that wide at all, which historically might strike some as a little unusual. Also, on independence, Fran, I imagine over the course of this campaign we will try to cover a whole bunch who are breathing down the necks of sitting members. Certainly that's our ambition. But Allegra Spender doing a little bit of disclosure on the run with you. My ears pricked up when she said she's raised around $1 million, and all of this doesn't have to be reconciled and declared for quite some time, but the Climate 200 element of that is presumably about $300,000. So that's a healthy war chest, I would have thought, for a seat like Wentworth. It is a healthy war chest, and I heard one of the other independents also taking on Liberal in the marginal seat. I think, I'm not sure if I can't remember which one it was. It was either Goldstein or one of the high-profile ones, yeah. Yeah, one of the high-profile ones, also suggesting they had a war chest of around $1 million so far in donations. Now, that suggests two things. The Climate 200 money is helping, the matching funding that they're all talking about, but also that a fair degree of community support, you would think, if they're gathering that much money. I'm not sure how that compares about the spends from the major parties in these kind of seats, but it's a lot of money. It sure is, and I guess we'll only get to reconcile all of those figures when we get up to full declarations. But Fran, interesting chats there today. We're going to farewell you. Thanks again. We'll see you tomorrow, same time. Fran Kelly back with us as always throughout the campaign, and then we will take a little break over the Easter weekend. But just before we go, we might just cover off another of those campaign gotcha questions. They seem to be coming thick and fast for leaders, and Greens leader Adam Bandt had his turn today. During that pre-election press club address we heard a little bit of earlier, he discussed the need to lift wages. Then the Financial Review's economics correspondent Ron Meisen asked what the wage price index is. Now, Adam Bandt didn't exactly have the answer, but his response was very direct indeed.
And just very quickly, talking of abject fact-checking exercises, you said in the speech that wages growth wasn't going particularly well. What's the current WPI?
Well, Google it, mate. I mean...
Google it, mate. Maybe that becomes the template for all gotcha questions for leaders throughout the campaign. Let's wait and see. That's it for Afternoon Briefing today. We'll see you tomorrow for Day 4.